Bell's palsy that affects 1 in 1,000 people per year, and it is that one side of the face suddenly droops down, is paralyzed. There's no paralysis elsewhere in the body. And the eyes hangs a bit down, the eyelids and the eye can't be closed properly, the mouth hangs a bit down, so the whole side of the face hangs down. There can be discomfort or a little pain to the ear, and also the taste on the affected side of the tongue can be affected. And in most cases it clears up within a few weeks completely. It can, by some people, leave a little muscle weakness around the mouth that drops down, or the eyelids. But this is according to Keith Watkins' Family Medical Advisor book on the page 89 and 90, but this is no medical advice. If you click this video away, then please tell me what the reason was so that I can improve. Otherwise, hi and welcome. I am trying to learn medicine. Today, Bell's palsy, and after we've done that, we're gonna do wrist training. And if you participate in the wrist training, then it's at your own risk. And we're talking about inflammation of the facial nerve. So we're going to talk about medical aspects and things. And this is no medical advice. I'm just reading the text here and trying to understand it. Now, this is the second time that we're reading it. We did it 70 parts ago in medicine. Now we're going over the text, trying to gather the information together and try to make from memory a presentation. Bell's palsy. Inflammation of the facial nerve causing one side of the face to droop. It affects less than one person in 1,000 each year, but can occur at any age. So one side of the face droops down. Symptoms: sudden paralysis of one side of the face, including weakness of the muscles of the forehead and eyebrows. The patient is unable to close the affected eyelids. The eye may roll up under the paralyzed lid from time to time to moisten and protect it. I don't understand the part of the eye rolling, but the one side of the face muscles are paralyzed, they don't move anymore, and it affects also the eyebrows and the forehead muscles a bit. The corner of the mouth on the affected side droops. The skin creases flatten out, and the eye will not close properly. Food collects between the teeth and lips, and saliva may dribble from the corner of the mouth. I don't think we have to describe the detail for our video. Also, the side of the mouth can droop down. There is no paralysis elsewhere in the body. Okay, that's a completely important. No paralysis elsewhere in the body. The sense of taste on the affected side of the tongue may be impaired. The taste on the affected side of the tongue impaired. So the tongue can on one side be affected. The taste, they don't say movement, but they're saying food collects between teeth. Would be interesting where the tongue goes. To what nerve, which nerve has power over it. There may be some pain and discomfort around the ear. Okay, we had now sudden paralysis of one side of the face, drooping down, also affecting the forehead and eyebrow muscles. The tongue on that side might not taste anymore. No taste anywhere else. No. The sense of taste impaired. Okay. And now paralyzed elsewhere in the body, and mouth also drooping down. And pain and discomfort around the ear. That's interesting. Duration. 80% of patients recover within a few weeks. Causes. The cause of the inflammation of the facial nerve is unknown. But there are known inflammations of the facial nerve, and when it is known. Okay, the cause is unknown. In this book from the 70s. Complications. Damage to the cornea of the eye. Permanent facial paralysis. Okay, it can stay permanently, and it can harm the cornea of the eye. Let's take one look where the cornea is, if you find it. It is the thing there in front. I don't want to say don't want to show the picture. It is the thing very in front of the eye, but I don't know which is it. No, it's very much in front of the eye. Damage to the cornea in front of the eye and permanently paralysis of the face. Gentle close the affected eye with the finger from time to time to prevent it from becoming too dry. Do not rub the eye. Don't rub the eye. Maybe close it with a finger. Prescribe a course of steroid tablets or injections, although the effectiveness of this treatment has not yet been proven, so we're not going to mention it. Arrange for testing and physiotherapy for the affected facial muscles. Prevention not known. Outlook. Recovery is usually complete after a period of weeks. Occasionally, muscle power on the affected side of the face does not return completely. Muscle power does not return completely. Why the muscle power? It can't be that the muscles are not working properly. I have not enough strength regaining. It must be, logically, that the facial nerve is still not completely perfectly operating and giving the signal to the muscles. It can't be that the muscles don't regrow completely. I don't think that after a few weeks. But I don't know, that is all speculating. I'm just thinking that it is a bit strange. A strange pathology. Occasionally, muscle power on the affected side of the face does not return completely, and the patient is left with some permanent weakness, particularly on the eyelids and side of the mouth. Are there minor forms of Bell's palsy? Unnoticed forms of Bell's palsy? Okay, we have it all. It should recover completely within a few weeks. It can happen that muscle weakness stays. At the eyelids and side of the mouth particularly. Okay, Bell's palsy. Sudden paralysis of the face, 1 in 1,000 people. The skin creases flatten out and the eye will not close properly. One side falls down. You don't have to make it exactly. Also mouth, tongue. I'm going to stop a second camera and try to say it. Sudden paralysis. Eye not closing, corner of the mouth drooping down. No paralysis elsewhere. Taste affected. Discomfort around the ear. Mouth recover completely. The cause is inflammation of the facial nerve. I think I heard that. I don't remember the name. Extended otitis media can cause Bell's palsy or facial drooping down, so that would be a cause. That would be inflammation or infection. Damaged cornea, permanent facial can stay, most clear up. Bell's palsy, that affects 1 in 1,000 people per year, and it is that one side of the face suddenly droops down, is paralyzed. There's no paralysis elsewhere in the body. And the eyes hangs a bit down, the eyelids and the eye can't be closed properly, the mouth hangs a bit down, and so the whole side of the face hangs down. There can be discomfort or little pain in the ear, and also the taste on the affected side of the tongue can be affected. And in most cases, it clears up within a few weeks completely. It can, by some people, leave a little muscle weakness around the mouth that droops down, or the eyelids. That is according to Keith Watkins' Family Medical Advisor book on the page 89 and 90, but this is no medical advice. I'm going to stop the camera. I think I forgot something. Wait, also take a part. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the wrist training, then it's already on. Hands fold the fists and bring them down to the spotlight. Up and down. And now to the inside, the flashlight and outside. And now flat hands and turn them to the inside and outside, the magician. Flat hands, turn them up and down, the pancake flipper. Now we're having 3 rules. First one is, if there's pain, stop immediately. Second one, go only as far as you can go with a little bit of effort. And the third one, don't overdo it. You just want to strengthen or to exhaust. We have a lot of exercises. Next one, we're having the hands out and bringing the flat hands down and out. The T-Rex in the move. Again, down. Now the quadrangular castle architect. Fists to the inside. Up. Out. Down. In. Down. Out. You can use the tennis ball. We're doing the T-Rex in the gym. Press onto it, otherwise make a strong fist. Release and pressing. Release and press. Switch and press. Release and press. And now the field daisies new Syntheas Dejecta. Fists and open and close. And the cautious big bang. One hand with fingertips on top of the other one and out slow. And across. The hand presses on top of it. The hand presses on top of them. And now the crab anxious to fever fist. Down. Press on the outside. You can take a break. These are a lot of exercise. And on top. And all carefully. No pain. Don't overdo it. And other hand. And now the hands up and bring the fists down and down. Again up. You can do this exercise, most of the other one also, way slower. Turn around and down. Again up, turn around, down, up, last time turn around, down. Now the Basco bridge. Hands like that and bend them down at the knuckles. And again up. And down. Now, the frog testing the water temperature. Hands next, down the flat fingers, and up into extension of strong fists. Down flat fingers, up extension. Down flat fingers, up extension. Now the claw. Hands and together make claws. Up and down. Try to spread the fingers. Up, claws, up and cross. Up and cross. And now the next exercise. Hands in, strong fists, and bring them in the fist. Then out the arms, and spread them, flare the fingers, and you get in. Strong fists, flexion, extension, flat fingers. Strong fists, flexion, extension, flat fingers. And the ice axe. Hand flat, bend it down, press on all 4 fingers. Other hand, bend it down, press on all 4 fingers. And I think, if we don't forget one, the last exercise. Forgot it. Something with a rocket. Long arms, strong fists, and bring them to the inside. Strong fists, and the outside extension flat fingers. The launching rocket. To the outside again. flat fingers, inside strong fists, flexion, and out flat fingers. And the last round. And now with a floor, go with moderate pressure of the middle part of the lower arm. And on the other side. There could be one to exercise more, but I don't know. It was Wristtraining. Hi, thank you very much, and at the next time.